Organ relationships, lung and kidney, liver and spleen. The lung and the kidney. The key points to note: the physiological relationships. Respiratory movement. The lung governs respiration while the kidney governs qi reception. Fluid metabolism. The lung regulates the water passage while the kidney governs the fluid. Lung and kidney yin nourish each other. The relationships between the lung and kidney are mainly manifested as mutual dependence in respiratory movement, water metabolism, and yin generation. Physiologically, the lung is the upper source of water and the kidney governs the water. On the other hand, the lung transmits the water downward to kidney by diffusion and descent of lung qi. On the other hand, the diffusion and descent functions of the lung qi depend upon the transforming and steaming functions of kidney yang. The lung and kidney act on each other to maintain the normal process of water metabolism. In regards to respiratory movement, the lung controls respiration and governs the qi, while the kidney stores essence and governs reception of qi. Respiratory movement is governed by the lung, but the lung's function of controlling respiration needs assistance by the kidney's function of reception of qi. Therefore, the body can keep the depth of inspiration and secure the harmony of respiratory movement. In addition, lung yin and kidney yin promote each other. Kidney yin is the root of every organ. Therefore, the lung yin depends upon the nourishment of kidney yin. The relationships between the lung and kidney are similar to the relationships of mother-son, according to the theory of the 5 elements. The lung fluid helps the kidney yin. They promote each other to keep the sufficiency and balance between them. According to TCM theory, it is called the mutual promotion of metal and water. Pathologically, disorder of the lung and kidney functions will cause disturbance in water metabolism, which will result in symptoms like oliguria, edema, cough, asthma, and phlegm. If both lung and kidney qi are deficient, it will disturb respiratory movement, resulting in shortness of breath and frequent dyspnea. Yin deficiency of both lung and kidney will cause symptoms of dry cough, tidal fever, and lower back soreness. The liver and the spleen. The key points. The physiological relationship is in digestion, the liver governs the free flow of qi, while the spleen governs transportation and transformation. Blood circulation, the liver stores blood while the spleen controls blood. The relationships between the liver and the spleen are manifested in 2 aspects. One is the interdependence of qi free flowing, as well as the transformation and transportation, and the other is the coordination of blood storing and blood controlling. As for digestion, the liver governs free flow of qi, while the spleen governs transportation and transformation. The liver governs free flow of qi, regulates qi dynamic, promotes the bile, and improves the transforming and transporting functions of spleen and stomach. Therefore, the liver governing the free flow of qi is the foundation of a healthy transporting function of the spleen. The liver stores the blood, while the spleen is a source of qi and blood, as well as controls the blood. When the spleen qi is abundant, the blood will be sufficient, and then the liver can store it. The liver and spleen cooperate with each other to prevent blood loss, as well as to promote the movement of qi and blood. If the liver fails in governing flow of qi, it will lead to failure of the spleen in transportation and transformation. There will appear the syndromes of disharmony between the liver and spleen, with symptoms like chest fullness, poor appetite, abdominal distension, and diarrhea. If deficient spleen cannot produce or control the blood, it will cause bleeding, which leads to the insufficiency of liver blood. If the liver cannot store the blood or the spleen cannot control the blood will escape from the vessels with symptoms like menorrhea and uterine bleeding. Thank you for your attention.
We discuss interviewing of patients with itchy eyes. Excluding invasions of external wind, itchy eyes are usually caused either by liver fire or a deficiency of liver blood, giving rise to liver wind. Itchy eyes and allergic rhinitis are a separate pathology which is not liver-related, but is related to external wind because the reaction caused by the invasion of allergens mimics that of invasion of external wind. In liver blood deficiency, the slightly itchy eyes would be accompanied by blurred vision, floaters, dizziness, numbness, or tingling of the limbs, dull pale complexion, scanty menstruation, pale tongue, choppy or fine pulse. Itchy eye secondary to liver yin deficiency will have floaters as well, dry eyes, blurred vision, dizziness, numbness, or tingling of the limbs, scanty menses, dull pale complexion, but with red cheekbones, withered and brittle nails, dry skin and hair, night sweating, normal colored tongue without coating, fine or floating empty pulse. Liver fire that causes severely itchy eyes would be accompanied by bloodshot eyes, painful eyes, headache, red face, dizziness, tinnitus, irritability, propensity to outbursts of anger, thirst, bitter taste, constipation, dark urine. Tongue would be red with redder sides and dry yellow coating, wiry, rapid pulse. Heart fire caused by itchy eyes will also exhibit red eyes, burning sensation in the eyes, redness in the inner canthus, palpitations, thirst, mouth and tongue ulcers, mental restlessness, feeling agitated, insomnia, dream disturbed sleep, feeling of heat, red face, bitter taste, red tongue with redder tip and yellow coating, overflowing rapid pulse. Liver wind that causes itchy eyes. The patient will also have dry eyes, blurred vision, tremors, severe dizziness, tinnitus, headache, numbness of the limbs, tics, stiff, deviated, or moving tongue, and a wiry pulse. For dump it in the gallbladder, the itchy eyes will also have discharge from the eyes, yellow complexion and eyes, blurred vision, heavy feeling in the eyelids, dizziness, hypochondrial pain, fullness and distension, nausea, vomiting, inability to digest fats, tinnitus, irritability, feeling of heaviness, unilateral or bilateral, thick, sticky yellow coating, slippery, rapid pulse. Invasion of wind heat causes itchy eyes with sudden onset, unbearable itching, aversion to cold, fever, cough, sore throat, stuffed or runny nose with yellow discharge, headache, body ache, slight sweating, slight thirst, swollen tonsils, tongue slightly red on the sides in the chest area or on the front part with a floating rapid pulse. Thank you for your attention.
10 Golden Rules of Eating in Chinese Medicine. The 10 Golden Rules of Eating in Chinese Medicine. Chew your food well. This will help the stomach to mature and rot the ingested food so that the spleen can transform it. From a Western perspective, the digestive process starts in the mouth. Chewing the food will increase the surface area that the digestive enzymes in the mouth can work on. Chewing will also help to physically break down the cell walls and mix the ingested food with the digestive enzymes. Furthermore, food that is physically cold will also be warmed up before descending into the stomach. This, as we will see in the second golden rule, is something that is important from both Western and Chinese perspectives. Avoid eating cold food. Example, food that is physically cold, such as raw vegetables, salads, cold beverages, and food eaten directly from the refrigerator, as well as food that is energetically cold. From a Western perspective, physically cold food will negatively affect the digestion because the gastric enzymes are most efficacious when the temperature in the stomach is between 37 and 42 degrees Celsius. When foods and beverages that are physically cold are consumed, these enzymes will be less effective and the digestion will thereby be weakened. Chinese medicine states that the spleen fears cold. The consumption of the energetically and physically cold foods and beverages burdens the spleen because the spleen must expend more yang qi to warm and transform the ingested food. In the long run, too many cold foods and beverages can lead to spleen qi shu and spleen yang shu. Eat as much prepared food as possible, especially things like soup and stews. This is because if the food has been cooked in some way, the transformation process has already been initiated, thereby placing less demand on the resources of the stomach and spleen. Even though there are more vitamins and minerals in a raw carrot, the body will not necessarily be able to access, extract, and absorb as many nutrients from a raw carrot as it will from a steamed, stir-fried, or boiled carrot. The cooking process helps to break down the cell walls in the food so that the nutrients can be more easily released into the digestive system and absorbed through the intestinal wall. If the person insists on eating raw or unprepared food, they should ensure that the food is very finely chopped or grated and that they can chew it thoroughly. Drinking some hot ginger tea with the raw food will also help. Do not drink too much water or other beverages and drink between meals. Too much liquid will drown the spleen's digestive fire. A single cup of hot water or tea can, on the other hand, support the process. The stomach hates dryness. This also makes sense from a Western perspective. Too much fluid will dilute and thereby weaken the acidity of the stomach. This will have a negative impact on the gastric enzymes, which function optimally in an acidic environment. Do not eat too much food. Eat until you are 75% full. Otherwise, you will overburden the stomach and the spleen, which could cause food stagnation because the spleen will not be able to transform so much food in one go, and the stomach will have difficulty rotting and ripening the food, as well as sending it downwards from the spleen that has transformed it. From a Western perspective, it takes a while for the brain to register that the stomach is full. This means that the stomach is full before you are aware that you are full. It also takes time for the food to move down through the esophagus and into the stomach. Eat your main meal as early as possible and avoid eating in the evening prior to going to bed. Chinese medicine posits that the yang process of the transformation and transportation halt at night and only begin once more in the morning, when yang activity in general increases again. This means that if you eat late at night, the food stagnates and remains untransformed in the stomach, where it will begin to generate heat. In general, the main meal should be eaten as early in the day as possible. In relation to Chinese medicine horary clock, the stomach and spleen are at their strongest between 7 and 11 in the morning, and therefore at their weakest between 7 and 11 in the evening. In Western medicine physiology, peristalsis and digestion cease at night, so the food remains undigested in the stomach. Many cultures, in fact, have sayings along the line of eat like a king in the morning, a peasant at lunchtime, and a beggar in the evening. Choose foods that have vitality. This can be seen, for example, when the vegetables are crisp and juicy or when the eyes of a fish are still bright and not dull. In practice, this means as much fresh food as possible. Freshly picked vegetables, for example, contain many more vitamins than vegetables that have been transported and stored. Avoid industrially produced food, such as a ready-made meal and canned foods. Not only do they contain very little qi, but they also usually contain various chemicals and additives such as preservatives, flavor enhancers, artificial flavorings, emulsifiers, and so on, as well as excessive salt and sugar. Enjoy what you eat. This nourishes the heart. We eat not only to create guqi, but also for a variety of emotional reasons such as comfort and security, as well as the sheer pleasure obtained from the taste, smell, and sight of good food. This enjoyment is often accentuated by the pleasure of eating with others. Strict Spartan diets will remove this source of nourishment of the heart. Frustration and irritation over dietary restrictions will also stagnate liver qi. If you're going to eat something that you know is not good for you, do so with guilt. Guilt will not only increase the negative effect that this food has on the body. Instead, really enjoy every mouthful, savoring the taste. Even though the food may be creating dampness or heat or whatever, it will at least nourish the heart. Try to eat in as tranquil a state as possible. It is best to sit down and relax whilst eating and to avoid stress and quarrels. Heated discussions can disrupt the liver qi, which may then invade and disrupt the stomach and spleen qi ji. Stress can also disrupt the qi ji in the middle jiao, as will worry and speculation. It is best not to read, watch television, or surf the internet whilst eating. Qi should be used to digest food and not information during the transformation of the food. Sit upright in a relaxed position and do not twist the trunk or sit in a slump position. A twisted or slump posture will block the free passage of food and qi in the middle and lower jiao. From a Western medicine perspective, these postures will hamper the peristalsis of the intestines. Gentle stretching exercises or going for a light walk after a meal will help to circulate qi in the middle jiao, thereby supporting the stomach and spleen qi. Or in Western terms, it will activate the abdominal muscles, thereby supporting peristalsis. Sun Si Miao recommended that a person walks 100 steps after meals, but that they do not count the number of steps. Thank you for your attention.
Diagnosis according to Sanjiao theory, pericardium heat. This corresponds to yin level heat in diagnosis according to the 4 levels. Etiology, exposure to pathogenic heat. Symptoms and signs, fever that is worse at night, insomnia, restlessness, dry mouth but no thirst, petechiae, skin rashes, unconsciousness or coma, delirium, raving. The skin of the torso can feel hot, but the hands and feet are icy cold. Tongue is dark red without coating, rapid fine pulse. Key symptoms, fever that is worse at night, dry mouth but no thirst, red tongue without coating, rapid and fine pulse. Treatment principle, drain heat from the pericardium and nourish yin, possibly restore consciousness. Acupuncture points to choose from: pericardium 3, pericardium 8, pericardium 9, DU14, DU26, kidney 6, spleen 10, and UB40. Needle technique is draining, bleed PC9, DU26, and bladder 40. PC3, PC8, and PC9 drain heat from the pericardium. DU26 restores consciousness, DU14 drains heat, bladder 40 and spleen 10 drain blood heat, kidney 6 nourishes yin. The patient will probably be in biomedical treatment when one has pericardium heat. Pericardium heat can be caused by lung heat or by no previous pattern and middle jiao heat. And this can result in lower jiao heat. Thank you for your attention.
Zhang by Sarah, lung physiological functions. The lung contains 2 main divisions, each one on the left and right, and both within the thorax. It is connected above the trachea, which opens into the nose. Among the Zhang organs, the lung has the highest anatomical position because of that is sometimes called the splendid canopy. Since the lobes of the lungs are delicate, intolerant of cold or heat, and highly susceptible to invasion by external disease evils, the lung is also known as the delicate organ. The lung is the chief organ for the regulation of respiration and for managing gas exchange between qi and the body. It also has the capability of depuration and dispersion. 1. Physiological functions of lung. Regulation of qi. The lung regulating qi means that the qi of the entire body is under the control of the lung. Thus, regulation of qi by the lung has 2 meanings. The lung regulates respiration and the lung regulates qi of the entire body. Regulating respiration. The lung is the respiratory organ through which the gases from inside and outside the body are exchanged. During the processes of metabolism, an enormous amount of fresh air is consumed, and simultaneously an enormous amount of its spent air is produced. The lung's respiratory function ensures that the fresh air is inhaled and the spent air is exhaled, thereby enabling the metabolic processes to proceed normally. This is expelling the stale and taking in the fresh. If the lung's respiratory function is normal, air moves smoothly through the passages and the respiration is rhythmic and even. Invasion of the lung by evil qi may cause tightness in the chest, cough, dyspnea, and impotence. If the respiratory function is lost, then fresh air cannot be inhaled and stale air cannot be exhaled, leading to cessation of all vital activities. See Figure 3.2. Regulating the entire body's qi. This function is mainly seen in the following two aspects. First, the lung helps in the formation of qi, especially thoracic qi. Thoracic qi is formed when the essential nutritious substances of food and drink by the stomach and transported by the spleen is combined with fresh air inhaled by the lung. Assistance from the lung is also necessary for thoracic qi to be distributed to the entire body through the blood vessels. Thus, by controlling the formation and distribution of thoracic qi, the lung acts to control qi of the entire body. Second, the lung controls the basic movement of qi throughout the body, which includes exiting and entering, and ascending and descending. The respiratory action of the lung is precisely the movement of qi in the body. Only the lungs' incessant, rhythmic, and even respiration can ensure the harmonious balance of qis in and out and up and down movement in the body, and further to maintain the body's normal physiological functions. If this function of the lung is abnormal, then the formation of thoracic qi and the activity of the entire body's qi will be affected, giving rise to such symptoms as shortness of breath, a weak and low voice, tiredness, and weakness. Thank you for your attention.
We continue with heart imbalances for diagnosis according to Zhang Fu organ patterns. Several of the other emotions will have an indirect effect on the heart by disrupting the functioning of their own organ. Anger, particularly when it is suppressed, that is, frustration and irritation, can stagnate liver qi. This can cause qi to stagnate in the chest and the heart. Liver qi stagnation can also generate fire in the liver, which can rise up to the heart and generate heart fire. Melancholy and sorrow will, apart from directly affecting the heart, bind and weaken lung qi. This can lead to qi stagnation, qi deficiency, and the accumulation of phlegm in the upper jaw and thereby in the heart. Speculation and worry will bind and thereby weaken the spleen qi. This can lead to qi deficiency, blood deficiency, and phlegm dampness, all of which will ultimately have an influence on the heart. Fear weakens kidney qi and can thus disrupt the cooperation and communication between the kidneys and the heart, as well as influencing the production of qi and blood. Shock has a direct effect on the heart. Shock dissipates and thereby significantly weakens heart qi. The heart is nourished by joy in all its manifestations. These include love and affection. A lack of these, particularly in early childhood, when the heart, like other organs, is not stable, can lead to a person developing deep-rooted heart imbalances that can affect them for the rest of their lives. Stress is not an emotion in itself, but it is a condition that consists of several emotional aspects. The composition of stress and the relative amounts of these emotional aspects will be different from person to person and from stress situation to stress situation. Nevertheless, stress will always affect the shen and consume heart qi and yin. Dietary causes of heart imbalances fall into two categories, those that affect the heart directly and those that affect the heart indirectly. Food, beverages, and medicine that have a lot of energy can directly create heat in the heart. Stimulants such as recreational drugs, coffee, and some types of pharmaceutical drugs can overstimulate the heart, thereby spreading and consuming heart qi and injuring the heart yin. Foods, drinks, and medicines that have a hot dynamic can, as well as creating heat in other organs that will ascend upwards, creating heat in the heart, lead to the formation of phlegm. Phlegm can also arise through excessive consumption of substances that in themselves produce dampness and phlegm. Heat from food stagnation in the stomach can also ascend and agitate the heart. Food stagnation can arise when food is consumed that is difficult to transform because of eating too much, too quickly, or too late in the evening. The diet needs to be nutritious enough to produce sufficient qi and blood. If it isn't, the heart can become qi deficient or blood deficient. Overworking, both mentally and physically, will weaken the heart. Physical exertion and strain, such as working too much and too hard, illness, too much sex, will weaken the qi and yang in the body. This can have both a direct and indirect impact on the heart. Mental and emotional strains, such as studying, mental concentration, thinking a lot, working with the computer, excessive use of smartphone, and stress will all consume heart qi and blood. Blood loss, such as heavy menstrual bleeding, childbirth, and operations can lead to heart blood deficiency. A significant loss of blood or fluids, such as extreme diarrhea, vomiting, or sweating, can weaken heart yang. Old age is characterized by depletion of qi, yin, and yang, as well as increased accumulation of phlegm and blood stagnation. These can all directly and indirectly affect the heart. Some heart imbalances that manifest as mental emotional disorders can be congenital, especially those that fall within the category of phlegm blocking the shen. There are several etiological factors that by their nature are not traditionally described in Chinese medicine. Computers and televisions can have a debilitating effect on heart yin because they overstimulate shen and consume heart blood. This is compounded when they are used in the evening or at night as relaxation activities. The evening and night are the in part of the day when our shen should reduce its activity and become more passive and reflective. This means the use of things that stimulate and activate the shen will have a stronger negative impact when they are used in this period of the day. That we are so active and awake in the evening and at night is a modern challenge for our yin. Staying up and being mentally and physically active was not so much of an option before the advent of electricity, and it has consequences for our yin aspects, particularly the heart and kidney yin. The heart has close relationships with several organs, and imbalances in these organs can lead to imbalances in the heart. Liver blood and heart blood are closely related, and a deficient condition of one of these will often result in a deficient condition in the other. The same is true of liver qi and heart qi. A stagnation of one will often lead to a stagnation of the other. Gallbladder qi and heart qi do not have a close functional activity on the physical plane, but there is a relationship on the psychological level. A person who is gallbladder qi deficient will also be heart qi deficient. Lung and heart qi cooperate closely in relation to zong qi, and a deficient condition in the lung will affect the heart and vice versa. The heart and kidneys have a yin and yang relationship to each other. Kidney yin nourishes heart yin and thus helps to control the heart's fire aspect. The heart's fire aspect helps to warm and activate kidney yang, and kidney yang supports heart yang. Furthermore, jing is the material basis for shen. Heat from the stomach can rise up to the heart and create heart fire. Urinary bladder imbalances can arise when there are heart imbalances, even though these two organs do not have a direct connection, either physically or functionally. Pathogenic heat from the heart can be transmitted via the heart's partner organ, the small intestine, to the urinary bladder, which is a Tai-Yang channel relationship to the small intestine. Furthermore, the urinary bladder diverted channel also connects to the heart. Thank you so much for listening.
Body fluids, physiological actions, relationships between qi and blood. Physiological actions of body fluids. Moistening, nourishing action. The fluid is distributed to the body surface, moistens and nourishes the skin and hair, the muscles, the eyes, the nose, the mouth, and others. The fluid transported to the internal organs, the bones and marrows, the spinal cord, and the brain nourishes and moistens these parts, enabling them to express their many physiological functions fully. The component of blood. Within the structure of the human body, the fluids continually enter the blood vessels by means of minute collateral vessels. Thus, body fluids are a basic component of blood. At the same time, through the confluence of fluids, both from outside and from within the vessels, they adjust the thickness and the volume of the blood. The relationship between qi and blood. Qi belongs to yang and has a warming action, while blood belongs to yin and has a nourishing action. The relationship between them can be concisely summarized as qi is the commander of blood, and blood is the mother of qi. The actions of qi on blood. The actions of qi on blood are centered mainly on three aspects as follows. First, promoting blood production. Qi is very important in the process of blood formation. Both nutritive qi and the body fluids are principal components of blood. From digestion of drink and food and extraction of essence from them to transformation of this essence into nutritive qi and fluids, to further transformation of nutritive qi and fluids to blood. Every step depends upon qi and its movement and transformation. This is the reason for saying that qi can generate blood. If qi is abundant, its ability to generate blood is strong. If it is deficient, its ability to generate blood is weak, and this state can lead to blood deficiency. Hence, clinical treatment of blood deficiency can often include augmenting qi. 2. Powering blood circulation. The circulation of blood depends upon qi. Most importantly, heart qi provides motive force, lung qi provides dispersion and depuration, and liver qi provides conduction and facilitation. If qi moves freely, so does blood. If qi stagnation or deficiency impedes its movement, then blood flow is impeded by stasis. This is known as blood stasis due to qi deficiency, or qi stagnation leading to blood stasis. If qi movement becomes erratic, then blood circulation flows the ascending, descending, entering, or exiting of qi and shows erratic behavior as well. For example, if qi ascends inappropriately, blood also rises inappropriately, producing such symptoms as flushed complexion, inflamed eyes, headache, and even bleeding. If qi descends inappropriately, blood also sinks, producing abdominal distension with rigidity or melena and metrorrhagia. 3. Stabilizing blood flow. For blood to circulate in its vessels without extravasation, the stabilizing effect of qi is indispensable. If qi fails in this stabilizing action, a variety of bleeding disorders can arise. In clinical therapeutics, these are usually treated by invigorating qi so that its stabilizing action can conduct blood back into the vessels, thereby stopping the bleeding. Second, actions of blood on qi. Blood is the carrier for qi and conveys it to the entire body. At the same time, blood continually supplies the nutrients qi needs to carry out its activities. This is known as blood is the mother of qi because qi is very active and can easily escape. It must attach to blood or fluid in order to remain inside the body. When blood is deficient or massive blood loss occurs, qi may lose this attachment and may scatter. This is known as qi collapsing following massive bleeding. Thank you for your attention.
We continue with dizziness due to liver yang rising with phlegm in the head. Clinical manifestations: severe dizziness, vertigo, tinnitus, irritability, propensity to outbursts of anger, headache, feeling of heaviness and muzziness of the head as if it were full of cotton wool, blurred vision, difficulty in thinking and concentrating, especially in the morning, a feeling of oppression of the chest, nausea, poor appetite, sticky taste. If there is liver wind, there will be tremor of a limb. Tongue is swollen with a sticky coating, pulse slippery to wiry. This is a common combination of patterns causing severe dizziness in the elderly. As liver yang rises, it carries phlegm with it, aggravating the feeling of dizziness. This is also a common cause of chronic headaches. Treatment principles: subdue liver yang, nourish the kidneys, resolve phlegm, tonify spleen, extinguish wind if necessary. Points: liver 3, GB 20, DO 16, liver 8, kidney 3, LI 4, stomach 40, REN 9, spleen 9, stomach 8, REN 12, bladder 20. REN 12, bladder 20, liver 8, and kidney 3 are needled with reinforcing method, the others with even method. Liver 3, gallbladder 20, and DO 16 subdue liver yang and extinguish liver wind. Liver 8 and kidney 3 nourish liver and kidneys. LI 4 regulates ascending and descending of qi to and from the head. Stomach 40, REN 9, and spleen 9 resolve phlegm. Stomach 8 resolves phlegm from the head. Ren 12 and bladder 20 tonify spleen to resolve phlegm. Thank you for your attention.